Hi everyone, this is Fostalicious DIY. Do it yourself. Today we are going to be discussing the topic angina, otherwise known as chest pain. We are going to be talking about all you need to know about angina today. Stay tuned and watch the video to the end. Angina is chest pain, chest discomfort, or chest tightness that may last for 1 to 15 minutes. This occurs when the heart does not receive enough blood oxygen. Now let's look at the facts about angina. Angina on itself is not a disease but a symptom of heart disease. Angina occurs when there is reduced blood oxygen reaching the heart. A patient with angina will feel chest tightness and difficulty breathing. Such persons with angina would need to adopt lifestyle changes, and they would also need to be on medications given by their doctor. There are 3 types of angina. There are different types of angina, 3 of them. Number 1 is stable angina or chronic angina. Number 2 is unstable angina. The third one is variant or Prinzmetal angina. Stable or chronic angina occurs when the heart is working harder than usual, especially when the individual is physically exerted during physical exercises or workouts, and during manual labor and any other activity that can physically exert the individual involved. This type of angina has a regular pattern in that it occurs when the patient is physically exerted, and it can last for months or even years. However, when this angina starts, the duration between when it starts and ends is quite short. In this particular type of angina, proper rest and medications, prescribed medications by a cardiologist or by your doctor, may ease off this pain. Proper rest and prescribed medications by your doctor will usually ease off this pain in a patient with stable angina. Now we are going to dive into unstable angina, which occurs at rest. This patient is not working out, he is not exercising, he is not doing any form of manual labor. He or she is resting, but even in his resting position, he has chest pain, otherwise known as angina. This type of angina, unstable angina, does not follow a regular pattern, and it is also less common but more severe. It is more serious because rest and medications does not relieve the symptoms. This type of pain can signal future heart attack. The pain lasts longer, takes a longer period of time. That is, between the time the pain starts and the time it ends, takes a longer period of time. This type of angina is often caused by blood clots that is blocking the artery either partially or completely. So if the blockage of this artery is more, as in larger blockage of the artery may cause heart attack in the individual. Number 3 type of angina is variant or Prinzmetal angina. This type of angina is rare and it is also known as microvascular angina. Variant angina also occurs at rest. It is severe, but it is without any underlying coronary artery disease. This happens when the arteries that are carrying blood to the heart around the heart muscle, arteries that supplies the heart muscle, that is the coronary arteries, when they go into spasm, which causes the artery to tighten up, thereby making it difficult for blood, oxygenated blood, to flow around the heart and supply the heart muscle. That is when this type of angina occurs. So this sudden narrowing and reduced blood flow to the heart muscles can be triggered by cold temperature, smoking, stress, and some certain medicines. These also can be treated medically. Now, let's go into the symptoms of angina. The pain from angina is usually felt in the chest region as chest tightness, chest heaviness, squeezing or pressure in the chest. Some patients usually have burning sensation or aches across the chest, which usually start behind the breastbone. In addition to the above symptoms, patients with angina may also feel indigestion, heartburn, tiredness, sweating, shortness of breath, cramping, and nausea. Now, we are going to be talking about the triggers, that is, the things that trigger this chest pain, which includes physical exertion, severe emotional stress, heavy meals, exposure to extreme temperatures, extreme cold or extreme hot temperature, and smoking. Treatment of angina. The aim of treatment in angina is primarily to reduce pain, because this pain can be quite disturbing. It can disturb your sleep, it can disturb your daily activities. Also, we treat angina to prevent other symptoms, and ultimately to reduce or prevent the risk of developing heart attack in individuals with angina. Lifestyle changes, which include your diet, being more active but in a gentle way, medical treatment and medical procedures to crush or to break down the plaques that are blocking the coronary arteries, so that blood can flow freely around the heart muscles and supply it oxygen. So the recommended lifestyle changes for the prevention and treatment of angina includes stoppage of smoking. If a patient that is having angina is a smoker, it is very, very essential that such patient stops smoking. Shed some weight if you are overweight or obese. Regularly check your blood cholesterol levels. Avoid strenuous activities and rest properly. Also, avoid large meals at a time. Avoid stress, but if you cannot avoid stress, devise measures of proper stress management. Very, very important. Eat fruits and vegetables, whole grains, low fat or no fat dairy products, lean meat and fish. For proper diagnosis and treatment, consult your physician, who will run some tests on you, which may include electrocardiogram, stress test, chest x-ray, coronary angiography, and some blood tests to check your cholesterol level, blood sugar levels, and protein levels in the blood. Risk factors of angina. When you have increased or elevated cholesterol levels in your blood, is a risk factor. High blood pressure, especially uncontrolled high blood pressure. Diabetes, especially when it is also not controlled. Tobacco smoking, those that are smoking all the smokable things, you are risking your heart. Being overweight or obese is also a risk factor. Sedentary lifestyle, not moving around, not taking walks, doing some light exercises, always sitting down in one place or lying down in one place. Do some things by yourself. Do it yourself. Age, greater than 45 years in males or greater than 55 years in females. If you have family history of early heart disease, it is also a risk factor. You can prevent angina or chest pain by changing your lifestyle. You change your lifestyle, ensuring treatment and proper management of other comorbidities like diabetes, hypertension, elevated blood cholesterol levels, obesity, as these can trigger or make your symptoms worse. Eat healthy, quit smoking, avoid stress. Life is only once. On the other hand, learn how to manage stressful conditions properly and be more physically active. So when you're able to avoid all the modifiable risk factors, you will be able to prevent angina, or on the other hand, prevent the disease from progressing into heart attack. On this note, I'm going to come to the end of this session. Feel free to like this video, comment, ask your questions in the comment section, and share this video to everyone, because it is very, very essential for you to know about angina and how to prevent angina, because prevention is better than cure. Thank you very much, and God bless.